And you consider it to be universal coverage?
I do, because what we do is set up a plan that allows anybody to get health care that is as good as the health care I have as a member of Congress. We will subsidize those who can't afford it. People won't be able to be excluded for pre-existing conditions, so that anybody who's self-employed, anybody who doesn't have health insurance or is underinsured can join this plan. Now, we also work to lower costs for those who already have health insurance, and so we expect to provide about $2,500 of relief per family for their premiums, and that is the kind of cost reduction that I think is going to be so important to make sure that the plan is sustainable.
The real difference between you and Senator Clinton is that you make your health care plan available to everyone. She would mandate coverage, though you do have a mandate for children. We asked her about that this morning. Here's what she had to say.
And the idea that you would have parents going uninsured, who are the main stays of their families while they are required to cover their children, makes absolutely no sense. So I think both on the merits and on the politics, his approach is just not doable, and it doesn't really represent democratic values or solving the problem.
Senator, she suggests that you're falling short here by mandating coverage for children but not mandating it for their parents. What do you say?
Well, let's break down what she really means by a mandate. What's meant by a mandate is that the government is forcing people to buy health insurance, and so she's suggesting a parent is not going to buy health insurance for themselves if they can afford it. Now, my belief is that most parents will choose to get health care for themselves, and we make it affordable. Here's the concern. If you haven't made it affordable, how are you going to enforce a mandate? I mean, if a mandate was the solution, we could try that to solve homelessness by mandating everybody buy a house. The reason they don't have a house is they don't have the money. And so our focus has been on reducing costs, making it available. I am confident that if people have a chance to buy high-quality health care that is affordable, they will do so, and that's what our plan does, and nobody disputes that.
Now, there's a couple of issues out there, though, in regard to that. There are studies that have shown that 70% or 20% of people who are uninsured make more than $70,000 a year, still don't buy health insurance. And Jonathan Gruber from MIT, who is a well-known and respected health economist, did a breakdown of your plan. He suggests that for $102 billion, which is greater than the cost that you've estimated, you cover about 23 million people. But if you added another $22 billion onto that to make it a total of 124, you could cover virtually everybody. So he suggests that your plan costs 80% as much as a mandated plan that would cover everyone, but only covers 50%. How does that make economic sense?